Good afternoon, colleagues. The title of my research is Dental Caries, Obesity, and Asthma During Childhood, a qualitative multiple case study to determine where community-based prevention strategies intersect to guide a coordinated approach. And that's a pretty big mouthful. So before I walk through the different elements of my poster, I just wanted to kind of give you the overall aim for this multiple case study is to identify the barriers and successful commonalities among community health strategies aligning with the spectrum of prevention framework that work to prevent dental caries, obesity, or asthma episodes during childhood. Learnings from this case study will provide recommendations for a coordinated approach to community health professionals for addressing these three health conditions more collaboratively. I'm going to zoom into the upper right corner of my poster that talks about the problem and the purpose statement. So, dental caries, which is just the scientific term for tooth decay, obesity, and asthma are common chronic conditions during childhood. Each of these health conditions is widely prevalent among children in the United States. So, not only are these three chronic health conditions common among children, but they can also be comorbidities of one another and share many of the same risk factors, particularly those risk factors influenced by the social determinants of health. Community health prevention strategies do exist for the prevention of tooth decay, obesity, and asthma during childhood, but the strategy efforts are more siloed. I feel there's a missed opportunity not to address the prevention of childhood tooth decay, obesity, and asthma more collaboratively, especially given their relationship. Successful health promotion and disease prevention strategies often require a systems approach. They require interdisciplinary collaboration and a well-educated community to align prevention messages and practices. So although it may seem counterintuitive, it's really because of the complexity of these three health issues and their need for multivariate strategies that health professionals, I feel, really should begin to address tooth decay, obesity, and asthma prevention more collaboratively. Moving to the lower right section of my poster, let's talk about the rationale for this study. So, research is lacking in community health strategies that collaboratively address tooth decay, obesity, and asthma among children. The prevalence and the severity of these three chronic conditions do necessitate prevention efforts with families, especially families of a racial minority or low income. So, community health strategies do exist for the prevention of tooth decay, obesity, or asthma during childhood, but that's just it. It's tooth decay, obesity, or asthma. It's not tooth decay, obesity, and asthma. And so far, these strategies are more siloed. And what I want to do with this study is really dig into why that is. What's going on there? Why are we addressing these? Individually, when research tells us that they are comorbidities of one another. So if a child has one of these three health conditions, they more than likely have at least one of the other two health conditions. So if we are really putting our resources and our time into engaging busy families of the 21st century to engage in these community health strategies to prevent one of these conditions, why are we not looking at it just a little bit broader and thinking about how can we address these conditions more collaboratively? Let's zoom in on the middle of the poster, which talks about methodology. So in this multiple case study, it involves parents, program staff, medical and dental providers, and community stakeholders from the programs led by the Center for Children's Health within Cook Children's Healthcare System. I will utilize propositive maximum variation sampling methods. I think the perspective of parents provides specific insight into the barriers that they face with seeking community health strategy services to prevent tooth decay, obesity, and asthma episodes with their children. The perspective of program staff, community stakeholders, and medical and dental providers really provide an awareness of what successes and challenges that these groups of individuals face in working to engage families in the prevention efforts around tooth decay, obesity, and asthma with their children. Data collection procedures will involve semi-structured interviews, participant observations, and document review. Data analysis involves within-case and cross-case analysis, aligning with the a priori theoretical framework, the spectrum of prevention. The spectrum of prevention has 6 different levels. And so once the data is collected, it will be analyzed through the lens of these 6 different levels. Let's zoom in on the lower left section of the poster that talks about the research question. So, due to the stratified sampling that defines the multiple cases within this research study, I am going to use an overarching question that pertains to all 4 cases, with each individual case having its own specific primary research question. And the decision to sort of investigate a primary question for each case is really because each purposefully selected case within the study provides a very unique perspective. So, in order to sort of synchronize the multivariate prevention efforts for tooth decay, obesity, and asthma from a community based strategies lens, the discovery from each case really must be treated as equally important, unique evidence. So, when looking at the last section of the poster, let's talk for just a minute about researcher perspective. I think it's really important to note that as the researcher for this case study, I have a constructivist worldview. I'm conducting this study to gain an understanding of the shared barriers and successes of community health prevention strategies addressing dental caries, obesity, and asthma during childhood. I have over 17 years of experience in the healthcare industry, and I have a deep desire to improve access to healthcare for vulnerable populations. The last 10 years, I have worked at the Center for Children's Health within Cook Children's in a few different roles, kind of working my way to my current position, which is Director of Evaluation and Measurement for all of our programs within the Center for Children's Health. So that does include those programs addressing dental health, obesity, and asthma. I have an intimate knowledge of the programs, the staff, the community stakeholders, and the medical and dental providers that will be providing data for this study. I am the primary instrument of data collection, so it will be really important to remain mindful of my positionality and reflexivity as a researcher. I want to, triangulate my data, use multiple sources of data collection, and use member checking and peer review to just make sure that I accurately depict what's going on within this study. So, in closing, I just want to say that from the research design and the questions, the participants for each case within this study were really purposefully selected to provide thick descriptions of their experiences that allow for synchronization of multivariate prevention efforts for tooth decay, obesity, and asthma from that community based strategies lens.